Thank you very much, Doctor, for your time this afternoon. So let's start off with that finding. The survey found that in 2018, and I'm quoting here, there were 390,000 positive cases of TB, but only 235,000 had been notified, and more than 153,000 had been missed. Why is that?
Good afternoon, Annalie, and good afternoon to the viewers. Thank you for the opportunity to speak more about the survey, which was the results of which were released by the Minister of Health yesterday. So the survey is a community-based survey, which means that we were going into the communities and asking people from their homes to come and participate. You would understand that that gives a different, it picks up different people than those people who go into hospitals or to a health facility because they are not well, because they have symptoms of TB. Or in South Africa, we know that if you have been in contact with someone who has been diagnosed with tuberculosis, we are always asked to be checked for tuberculosis. So it's not a surprise that you would find more people in the community than you would find from those who are notified from the healthcare facilities. So that is the major cause for that difference. It's not something that is entirely surprising. What we may talk about is the difference between those two numbers.
So prior to COVID-19, did we see sufficient numbers of people being successfully treated once TB had been diagnosed? And how did that change during the pandemic?
So the survey, as you would appreciate, was conducted between 2017 and 2019. It really focuses on 2018. It was before the pandemic. What we've heard reported from government, which is not part of the survey, is that obviously with all the changes and everything that is happening, there has been data that came out from the National Institute of Communicable Diseases around the notifications or the diagnosis and the pickup of cases during this COVID crisis. That information is available from the National Department of Health website and also from the NICD website. And it's something that even the Minister of Health spoke about in terms of how the government is really much aware of this and the implications that COVID has had on how people seek care and how they are detected. One of the things that was clear that the Minister spoke about yesterday was this TB check in terms of trying to reach people and make it more easy for people to do self-screening, as we have been told also for COVID. But I just want to stress that the survey happened before COVID-19 and these results pertain to 2018.
So as part of those results, what did the results say about the number of people accessing treatment in 2018?
So the survey was looking at the burden of TB in the community, and those are the numbers that we reported. What we also were looking at is how people seek care if they've got symptoms. And from our report, from those that we screened who reported any one of the 4 symptoms that are commonly associated with TB in South Africa, which is cough, fever, loss of weight and night sweats, almost 2/3 of them had not yet sought care for the symptoms that they were experiencing. And there were various reasons for this. Some of them were still planning to seek care. It's possible that they were going to seek care, but what our concern is that we would like people to seek care if they've got anything that is suggestive of TB as soon as is possible. Some of them said they did not regard their symptoms as being serious, and that one of the recommendations that we made was that we need to increase awareness around TB symptoms, but also that these symptoms are serious. We need to act on them. They are not something that we can leave as something that is not important. There were some who said that the facility was too far away for them to reach, and they did not have money for them to reach the facility. And even in that webinar that we had when we presented the results, there already are steps that the Department of Health is taking to address those issues that we identified in the survey.
We know that stigma also prevents people from accessing care. So are we making sufficient strides in addressing the stigma related to TB and HIV?
Yes, I think that in South Africa, there's been a lot that has been done to address the stigma associated with TB and HIV. So in this surveys such as these and dissemination of information as we are doing now, it also helps to let us all know that TB, HIV, COVID-19, all these are conditions that any one of us can get at any time, and we can go and seek care. The Department of Health has made facilities and pathways available for us to go and seek care. And so we hope that by speaking about these findings, talking about the recommendations, and with the Minister and the Deputy Minister speaking around what is already being done to address some of the challenges that we found, it goes a long way into mitigating the stigma related to TB.
Well, thank you very much for your time. That was Dr. Sizulu Moyo, lead researcher at the Human Science Research Council.